Welcome. Welcome, everyone. And as folks continue to trickle in, say hi in the chat, and say hi in the chat, and we're just going to dive right in. So thank you for everyone that can be here with us tonight and joining us for this powerful conversation with some incredible people who you will hear from very shortly. So my name is Kat Walden, and I use she, her, and her pronouns, and I'm located on the unceded land of Lenni Lenape, also known as Philadelphia, Pennsylvania. And as a visual description, I am a light-skinned Black woman wearing a dark olive green shirt, glasses, gold studs in front of a white background with various artwork behind me. So tonight we are really excited to dive in to learn about a bunch of things. And there are a couple goals with this conversation. So one of the first ones is for us to understand the history of HIV criminalization and where movements and formations are currently. The other is for us to be able to make connections between HIV criminalization and abolition, which is one of L4BL's core values, and how HIV criminalization is connected to a lot of issue areas that groups are focusing on right now. And lastly, we want to help movement lawyers and legal advocates, so our network, our fam, be able to understand what roles they can play in efforts to abolish HIV criminalization and amplify the voices of the organizers in this movement. And so we've been wanting to have this conversation at Law for Black Lives for a really long time, because it's something that we care deeply about, and it's also something we want to learn more about and be able to support and be able to tap into our network to support as well. And we also believe that it's something that's not being talked about enough in a lot of the legal spaces that we are currently in. And most importantly, as I had mentioned, is that the intersectionality between HIV decriminalization and abolition, and talking about how we can abolish HIV criminalization and how people are going to be able to bring, how people can be able to bring their full selves to the movement towards liberation. So tonight, we're going to spend a lot of time in discussion with our three wonderful panelists, and then we'll leave room for a Q&A at the end. But feel free to drop your questions in the Q&A box or in the chat. And then after the Q&A, we'll close out. And also feel free to use the chat to show some love and appreciation to our panelists. So as I mentioned, this incredible group, I'm fanning, I'm in admiration, even since when we first met. And so I'm going to turn it all over to you to let you all introduce yourselves. And so I'm going to start with Linda. And if you could answer the first question that we have, which is, can you just, introduce yourself, your name, where you are, a visual description, as I did, and then can you give us a brief overview of your organization and its mission towards HIV decriminalization, or your experience with HIV criminalization? And then you can pass it to whoever you'd like to answer that question.
Absolutely. Thank you so much, Kat, and good evening, everyone. My name is Linda Dixon. I'm the Health Law Director at the Mississippi Center for Justice in Jackson, Mississippi. And I'll give you my visual description real quick. This is my first time doing this, so this is pretty cool. I'm a brown female woman, short hair. I'm wearing black today, nude lip, and light makeup. How about that? So the Mississippi Center for Justice is a nonprofit public interest law firm committed to advancing racial and economic justice. We look at all of our work through a racial and social justice lens, which includes HIV criminalization. We have two big bodies of work in the Health Law Division. One is access to health care, and the other is HIV discrimination and stigma. So we are very committed and rooted in Mississippi in seeing reform here with HIV criminalization. Now I'll pass it over to Jada.
Hi, everyone. It's such a pleasure to be here with you all this evening. My name is Jada Hicks. I use she, her pronouns. I am a staff attorney at the Center for HIV Law and Policy. As a visual description, I was laughing because it's my first time doing this, and I was like, my brother would always describe me as beige. So, beige woman with long curly hair, glasses, and a black t-shirt. So at the Center for HIV Law and Policy, we fight stigma and discrimination at the intersection of HIV, race, health status, disability, class, sexuality, and gender identity and expression, with a focus on criminal and public health systems. We approach this work really through a Black, feminist, abolitionist framework. And so we are really involved in not only decriminalizing and destigmatizing HIV, but other highly stigmatized diseases such as hepatitis. And I will go ahead and pass it over to Eric.
So good evening, everyone. I am Eric Paulk. I am calling in tonight from Atlanta, Georgia. I use he, him pronouns. In terms of a visual description, I am a dark brown Black man wearing a navy blazer and a pale blue shirt with a mustache, and I would say a struggle beard is my description, my visual description. I currently serve as the chief of staff at Pro Georgia. Pro Georgia is Georgia's progressive C3 table. But prior to joining Pro Georgia, I spent a lot of time specifically working on HIV criminalization and issues related to HIV policy. So prior to Pro Georgia, I served as deputy director at Georgia Equality, where I led all of the HIV policy work there. Prior to that, I was at Lambda Legal, where my area was HIV in the law. And I currently serve as the co-chair of the Georgia HIV Justice Coalition, which is the coalition that helped to reform Georgia's HIV law in 2022. That was last year. It seems like so long ago. And so I'm super happy to be here with my colleagues and friends, and looking forward to the conversation.
Amazing. Thank you all for those beautiful introductions, lovely visual descriptions as well. So we are going to just dive into our discussion. So I'm going to throw the first question at you, Jada, which is, can you talk about the movement of HIV criminalization and its history and where we are now from a national perspective?
Yes, if you wouldn't mind sharing your screen to show the slides, and I can just go ahead and get started. And I'm just going to give a brief overview of, again, the movement of HIV criminalization and really where we are now, give a little bit of history so that we can really ground this conversation. Next slide, please. I'd like to start just talking a little bit about the Positive Justice Project, which is one of the major projects and a large part of the work that we do at CHLP, where our goal is really to end laws and policies that subject people with HIV to arrest and increase punishment solely based on their health status. We're actually involved in quite a few states. I actually think this might be the largest number of states that we have been in since PJP was started in 2010. So we're ever growing, ever expanding. Next slide, please. In terms of what the Positive Justice Project, entails, we do federal advocacy. We've done a lot of work with Barbara Lee's office to improve federal policies and target federal agencies, PACHA as well, which is the Presidential Advisory Council on HIV and AIDS. We do legal research and report on legal developments and trends and challenges that exist in relation to criminalization, specifically HIV criminal laws, including technical support to attorneys that are handling cases for people charged with these offenses. We engage with public health leaders, agencies, and professional organizations in order to try and end HIV criminalization. And state advocacy, is really our bread and butter, where we provide resources, legal support, and infrastructure to local and state-based community advocates. That's actually how I know Linda and Eric is engaging within their coalitions within Mississippi and Georgia. Next slide, please. So I always like to start with this question: what is HIV criminalization? I want us all to have the same definition when we're going into this conversation. So HIV criminalization has to do with criminal laws that target people living with HIV for conduct that is legal for individuals who have not been diagnosed as HIV positive. For instance, this would be consensual sex. We're also talking about laws that specifically increase penalties for people living with HIV for conduct that would be less severe offenses for others that are living without HIV. A lot of times we will see this, for instance, in correctional facilities, prisons, or jails, where we see that spitting, for instance, is already a crime. Typically a misdemeanor. However, if you are a person living with HIV and you spit on a guard, it will automatically become a felony. So just based on their HIV status, the penalty is going to be increased. So really, we're talking about applying any criminal law in any way that makes HIV status a necessary component of the offense. A lot of times we will see in states when they charge under their general criminal code, we see HIV being classified as a deadly weapon for aggravated assault cases. We also see sometimes HIV being characterized as like a bioterroristic threat. So it's really going to be the charges centered on your health status. And that is what we're talking about when we are addressing the issue of HIV criminalization. Next slide, please. The national scope of HIV criminalization, this is going to give you like a quick overview of what we're looking at within the United States. 30 states have HIV specific laws that impose criminal penalties. And this is going to be misdemeanor or felony level punishments that explicitly target people living with HIV. These laws can either be found in the criminal code. In some states, though, they are found in the public health code. These laws usually don't take medical advancements into account, and they criminalize conduct where transmission can't even occur. Next slide, please. We also have 6 states that have HIV-specific offenses that require sex offender registration. And in some states, this is particularly harsh. For instance, in Tennessee, it actually requires a lifelong registration if you are convicted of an HIV criminal exposure offense there. But we also see many states have harsh sentencing enhancements, particularly for people that engage in sex work. Again, this is going to be someone that engages in sex work. If they were not HIV positive, it would be a misdemeanor. However, if an individual with HIV agrees to commit or engage in sex work, it can be an enhanced punishment from a misdemeanor to a felony. And at least 25 states prosecute people living with HIV under their general criminal laws. And again, that is when we see something like aggravated assault. We've even seen attempted murder, those bioterrorism laws. All of that is going to fall under the general criminal code. It's really anything where a prosecutor feels like they can prove the elements of the crime. Next slide, please. And the next slide is just going to be a quick snapshot of everything that we just discussed under the scope of criminalization. This is available on our website, HIVlawandpolicy.org, and it's color-coded for your convenience. It's just going to tell you which states have HIV-specific criminal laws, what enhancements, where sex offender registration is required, and where they can use the general criminal code. Next slide, please. This is going to be our timeline of state reforms and repeals. So a lot has happened over the years. We've had a lot of success. You will see that Georgia is on here, and this is also posted on our website. It continues on to the next slide, Kat. So if you can go to the next slide, please. It just details what year every state that has reformed, when they reformed, and what those reformed entailed. We also on our website have before and after breakdowns that'll give you kind of a more in-depth look at what these states have done and how they have reformed their laws. So some of them, for instance, Texas in 1994, they did a full repeal and you can get criminalized under the general criminal code there. Other states like Nevada, when they did their reform, they made sure to mention that only the public health code should be used for any offenses that involve HIV. So really trying to take a public health approach. And then you'll see states again like New Jersey, where they're the third state actually after Texas and Illinois to fully repeal their HIV specific law, but then having a provision where they still allow for prosecution under the general criminal code specifically, and even naming that in their statute. Next slide, please. And actually, if we could go to there we go, perfect. So what are the problems when we're talking about HIV prosecutions? Typically, they don't require transmission. They don't require a significant risk of transmission. So we see that when we see spitting is criminalized, and it doesn't require an intent to harm. It's oftentimes enough that individuals living with HIV have consensual sex and don't disclose their status, even though they don't transmit or there was little to no risk of transmission. And we see that sometimes when individuals are virally suppressed and can't transmit. Proof of disclosure is the only defense, meaning it's going to be one person's word against the other. And we see severe and disproportionate punishment. I mean, depending on the state, you can see the same level of punishment as manslaughter sometimes. Next slide, please. HIV criminalization also doesn't promote public health goals, so there's no evidence that these laws or prosecutions deter quote unquote risky behavior. And what that means is just that there's a higher risk of transmission in certain sex acts. It doesn't deter that. There's no evidence that they reduce the rate of new HIV diagnoses or the prevalence of HIV. We've also heard anecdotally that it disincentivizes individuals to learn their HIV status because you have to know your status in order to face prosecution. It obviously is going to create and feed into medical mistrust and alienate patients from their providers. Next slide, please. I think one of the most important things is that it sends a one-sided message about sexual health. It's all on the person that's living with HIV, and it's solely their responsibility and treats them like vectors of disease. And it disproportionately harms marginalized communities, Black people specifically, people of color, LGBTQ+ communities, sex workers, and undocumented immigrants. And we also know that it promotes stigma. It feeds into the stigma that we have surrounding HIV in general and the realities of the roots and risk of transmission. Next slide, please. So HIV criminalization is much more expansive than people normally think. It's much more than these jilted lover stories that you typically hear. In fact, the vast majority of arrests and prosecutions target sex workers or sting operations. We know from the data that we have collected, specifically with the Williams Institute out of UCLA, that it's racist bias in arrest and prosecutions. And it clearly shows that it's selectively enforced overwhelmingly on Black women and men. So we know that. And not only that, but HIV criminalization is a part of a broad legacy of anti-Blackness, misogynoir, dehumanizing sex workers, and criminalizing poverty. Next slide, please. And this is just going to wrap up my portion for this question, is really to point out that HIV criminalization and issues related to HIV are very intersectional in nature, and they feed into each other. So I took this and I singled out mass incarceration, and you see that all of these issues feed into not only mass incarceration, but HIV. So we have unemployment, housing instability, substance use, healthcare. You can really replace any single issue that is listed in the middle with mass incarceration, and it will still continue to feed the cycle. And so when we're doing this work, we really need an abolitionist framework that is going to look at all of the systemic issues and structural interventions that need to be addressed to end HIV criminalization. That's the lens that we want to approach this work through. It's not a silo. They really feed into one another, and they perpetuate one another as well. And so when we are grounding this conversation through an abolitionist framework, we're looking at it through how do we end these systems that continue to affect our communities and continue to feed into the HIV epidemic. And the last slide is really just contact information. If you want to reach out at any time, please feel free.
And we can put that contact information in the chat as well. Jada, wow, thank you. That was, my brain is in a million different places, but that was super powerful and incredible. And especially that last slide of you that I think really gives, as a visual learner, it gives a good visual of the intersectionality between HIV criminalization and mass incarceration, and how like HIV criminalization falls into us abolishing, abolishing prisons, abolishing, you know, disproportionate, all these things. So thank you so much for that. And as you said a lot of this is also on the website as well, some of those graphics and the timeline specifically. So I know there was a lot of information on there. I'm definitely going to go back and read some of that, or read all of it. And so we'll drop those links in there as well. So I'm going to open it now, the discussion up to everyone for this next question that I think will get into some of the work of movements and formations and why we're here to learn, like, what's happening on the ground, what can we be doing? So to all of you, how is the work of local formations impacting the overall movement and Black communities in particular? And what do you feel like people need to be hearing and learning? And this is kind of a big question. So each of you, so take us not as much time. We have about 10 minutes for each question, but to answer it. So it's in the chat as well. And Eric, I'm going to start with you, and then you can kick it to whoever you'd like.
All right. So thank you, Kat. So I always like to kind of start this with, like, you know, framing HIV criminalization as really a broader part of the broader conversations that we're having about, you know, criminalization broadly. I think that it is also a part of the conversations that we're having about bodily autonomy. And then I think the third part really is about sort of like truth and reconciliation. And so just to kind of combine those, you know, three things, you know, when you think about sort of between 1877 and 1950, like over 4,000 Black men, women, and children were lynched. HIV criminalization and HIV criminal laws are a part of that legacy, are a part of a legacy, you know, that really this country hasn't dealt with at all, which is about, you know, this fiction that Black people aren't fully evolved, that we are less human, less worthy, and less deserving of than white people. And so I think that as we start to sort of like unpack a lot of this, what we'll see is a lot of the intersections, you know, if it's, you know, the work that's happening in reproductive, you know, justice spaces are very similar to, you know, the work that's happening in our sort of HIV movement spaces as it relates to this sort of like idea and concept around like the state having control over how Black bodies move, function, and operate. And prisons, you know, themselves are, you know, sort of the greatest way that you're able to like strip someone of that autonomy. And so when I think about sort of like local formations and things that folks are working on the ground, you know, the work that I do now is in the democracy space, you know, really comes back to conversations about, you know, how do we really think about reconciling really, you know, the stain of slavery, you know, and how do we like unpack that and bring that into the conversations that we're having. I think it allows for us to build more power across movements. And I think folks are starting to see like all these things are really like very, very intricately, you know, intersecting. And I don't mean intersected in the way that, folks overuse intersecting, but like, they are really like so tied together that if we're not careful and working together, we can't undo the knot. And so I think, conversations like this one, with organizations that maybe haven't been as, vocal about this issue in particular, I think allows for us to like elevate the work in a way that it hasn't been elevated in the past, and allows for us to really sort of like drill down to like what the real issues are about, and not just sort of like see HIV criminalization as a sort of like niche issue, but really as an issue that is impacting Black communities and that is a part of a larger narrative. I'm gonna stop there and I'll pass it over. I'll pass it over to you, Linda.
Thank you, Eric. I really appreciate that HIV criminalization has taken on a national and regional landscape. It's great to know that in Mississippi, in the Deep South, that we're not alone in this plight, and that from a regional and national perspective, it helps to be able to elevate what's going on, not just in Mississippi, but all over the country. And we want to get on that timeline, Jada, where we have reform here in Mississippi. And my message to folks here, and I love how you frame the question, Kat, how is the work of local formations impacting overall movement in Black communities in particular? And what do people need to be hearing? In Mississippi, I want to say we can do this. We have dynamic and committed advocates in Mississippi. And, I think one of the main things we have to do is normalize HIV and, just not enough of that is a manageable, treatable medical condition that should not be criminalized, period. I mean, this shouldn't even be something that we have to address, but it's here. And Eric already laid out the historical perspective of how we even got here. In Mississippi, we have a Mississippi HIV decriminalization network. So that network, we're looking at how we reimagine the movement with an organized effort to reform this statute, because we've been working on this for some years. And so to be able to say, how do we reframe this? How do we reimagine? We want complete reform. We don't want bits and pieces because it shouldn't be here anyway. So we want to, of course, address, which is huge, stigma. We know that discriminatory practices, behaviors, and laws are deeply rooted in stigma, which is why they're there to begin with. And just the science of it all, in Mississippi, our law is the science is not even accurate. So that's a problem. So, what do we feel like people need to be hearing and learning? We need to make sure that people understand the history, the stigma behind it, and to even, have conversations, greater conversations with prosecutors and law enforcement and policymakers about why this shouldn't be here and why it's not good for all Mississippians. I love your slide, Jada, on the intersectionality of mass incarceration and how it overlaps. I couldn't help but think some of the points on that slide was an overlap with the social determinants of health. And that was pretty shocking for me to see it, although I know it, but it's a reminder of how this is not just an issue from a criminalization standpoint, but across the board, how it affects people living with and impacted or affected by HIV. And I'll turn it over to Jade if she has any comments or thoughts.
Yeah, of course, I echo what Linda and Eric have already shared, but I think one of the things that I wanted to point out about how local formations are impacting Black communities in particular, I think one of the major things is rethinking and reimagining how we discuss and think about HIV from the ground floor up. So, for instance, particularly in Southern states, even engaging with faith leaders, right? To stop demonizing the LGBTQ plus community and those living with HIV, trying to, within the Black community, redefine how we're speaking about these issues. I think that's a really big thing. And it's really important to combating the stigma that surrounds HIV. And what people need to be learning is exactly what we're talking about on this phone call, honestly. That HIV criminalization is another tool in a racist toolbox. We see who is bearing the brunt of prosecutions. We see how these laws are being used as a tool by certain police departments to over-police Black communities specifically, and especially those that are already marginalized and share have intersecting identities. So Black and LGBTQ, Black and sex workers. It's really singling out people, that they consider outside the bounds of society, and another way to, as Eric was saying, continue this demonization and this anti-Blackness legacy that has persisted in America. And so I think it is important as part of this conversation to really thread the needle and tie all of that together in as many spaces and in front of as many audiences as we can.
Thank you for all of those responses. And I mean, especially I think just talking about the intersectionality, the normalizing of HIV, the need to just be having these conversations more and more is so important. And, you can see it in the chat, and you can see it where everyone's like, oh yes, like all of this, like it connects. And when we're fighting one thing, that's how we're going to get to the other thing. And like, it's getting to the root of it, which is so important and hard. It's not like all of the work that you are doing is hard. It doesn't go unnoticed. So also just a lot of like love and appreciation, and thank you for bringing this here in this space. And I kind of want to add a little bit more to that question, which is talking about like what specifically does your work look like, and what do you think the work of organizations that you're in partnership with, whether they specifically focus on HIV criminalization or not, or decriminalization, excuse me, intersect with abolition? And like, what are these organizations do you think? I know we just said this about like, what do people need to be like learning and doing, but like in terms of movement organizations and formations doing this work, and how do they get to that abolitionist framework in terms of HIV decriminalization? And then also, there's a lot of questions. This is the first part of like, how does your work do that? How does your work amplify and express the intersection with abolition and HIV decriminalization? That was a lot. The question will be posted in the chat. And I will kick it to Linda to start.
Thank you, Kat. That is a loaded question. Some will go in a lot of different ways, but at the Mississippi Center for Justice, we look at the issues that we address, and we don't just do health and HIV work. We do a lot of different things: housing, education, heirs property, economic justice, but we look at it through a social and racial justice lens. And when I think about from an abolitionist standpoint, abolishing the system of racism is huge. This is a part of what that systemic issue, and even the systemic approach we'll have to take to eradicate stigma and to eliminate laws that should not even be on the books. And people shouldn't fear testing because they fear being criminalized. I mean, that is just frightening in itself to think about people who don't even know their status for fear of criminalization. So I think about like even, the majority of people in Mississippi diagnosed with HIV are Black. We're talking about maybe 78% maybe, and Black people make up 38% of the population. So there's a disproportionate impact and burden on Black people to begin with. And when I think about even the threat to public health, because that in itself deters people from getting tested, and folks are not going to be inclined to disclose to their partners. And for some, we know are not going to even go into care if they fear retaliation. And that's just in itself scary to think that this is happening because of decriminalization or criminalization with HIV. And I may have missed one of your, did I miss anything? No?
No, I think there were like 20 questions in that one. And I think you've also, if there's more that you would like to say in like that second half, and I think you've all gotten to it of like, why are the people who you do this for, who you work on behalf, you're in community with, wanting to decriminalize, HIV, and what is specifically in Black communities, and I know in the South. And so, yeah, if you want to answer to that part as well.
I would like to, thank you. So I mentioned earlier, we have a Mississippi Decriminalization Network. It's a coalition, and one of the coalition members is on this webinar, but it's a coalition of people that are concerned and very engaging with reforming the statute. It's wonderful to have national partners like Jada and folks like Eric who have helped support our efforts here with research and with, from the legal implications and the policy perspectives. But people are concerned about this across the board. So, we do have, as I said, a dynamic group of folks who are working on this issue. And, we are coming together, not just prior to a legislative session, but we're working year round to help build a groundswell and to garner support from, this is everybody's issue, everybody. So we want to even, reach out and work with, and I'm gonna say unusual suspects, but people who you wouldn't think would, we don't wanna just talk to ourselves. We wanna talk to the community at large. We wanna talk to business leaders and policymakers and other stakeholders. So the beautiful group of folks is representative of lots of populations in Mississippi and people who are engaging. And those folks on the Decriminalization Network Coalition, they have their tentacles in their respective communities. So it transcends beyond coalition efforts.
And I just want to
pass it over to Eric.
Go ahead, Eric. I can wait.
No, go for it, Kat.
No, I just wanted to echo and re-say that this is everybody's issue. And I know like that's just so important. Like we all need to be having these conversations. And the fact that's like it shouldn't just people are talking to themselves about it. So no, I was just like, whoo, wrote that down like, So Eric, go ahead.
Yeah, I mean, I think for me, like part of it is like working now in kind of the democracy space. At Pro Georgia, as a C3 table, we currently have about 61 partners. And, our partners are doing work from everything from, LGBTQ rights to reproductive justice, to environmental justice work. And so this is sort of like core to a lot of the work that is already sort of like happening, among organizations. And so I think a big part of the work then becomes, kind of to what we've been alluding to, since the start of this conversation, which is about like, how do you bring other folks into this conversation and help them really understand how these pieces are all really, tied together. And I think that as, a table, we've been able to do that with a number of other issues. And it makes me confident that, HIV criminalization, also becomes something that can like easily become a part of that conversation. And people start to sort of like see like, oh, like this makes more sense than what I initially thought, like once I really have like a real conversation about it. Because I think that's the other thing. I don't know if people are in real conversation with folks about like why HIV criminalization laws are bad. I think that, on its face, like people are like, oh, that makes sense. Like, someone, targeted, someone to transmit, this disease to, oh yeah, they should be punished. And we're like, well, that's not even usually the scenario that we're talking about. And so I think that people need to have that sort of like base level education. And so I think a part of like what moving some of that looks like, especially in the democracy spaces, what does a voting bloc of people who are living with HIV look like to really drive change, across states? I think that if we look back into sort of like the HIV movement history, there are folks who are really like invested in this like civic engagement work to really push the policy changes, a lot of the policy changes that we have now. And so I think that, if every ASO that we work with, had like opportunities for people to register to vote, when folks are, coming in to, get a checkup or to get tested, that this becomes a real way for people to like, tie something that is very important to them and then give them a real tangible action to take part in and participate in. And then those people come down to, Linda's lobby day at the Capitol, and so we have 500 folks who are like living with HIV or impacted by HIV saying, we need to change these laws. And if you have that to happen, even in Mississippi, like that starts to move, folks who weren't, thinking about, changing before. And so I think some of that is a part of how we start to think about some of the work that's happening in community. I'm trying to read the second part of the question, Kat, to make sure that I got everything. Why are the people you work with interested? They're interested because they're able to see how this is similar to their work. And they've arrived at the understanding that like, we gotta be in this all together in order for it to work. And if we're not in it all together, we're gonna lose every time.
And I think as far as the work that I'm involved in at CHLP, really with abolition, obviously, it would be a dream if none of these laws were on the books and people actually weren't facing prosecution under either the general criminal code, the public health code, or HIV specific criminal laws either. However, within the abolitionist framework and the work that we do, a lot of times what that's going to look like is really reforming these laws in such a way that we cabin prosecutions, that we're making sure penalties are misdemeanor level instead of felony, that we're getting rid of sex offender registration, that we're trying to make sure that the law catches up to medical data and science we know and have about routes and risk of transmission. So it's not going to encompass activities that's not known to transmit or not likely to transmit. So I think all of that still falls within the abolitionist framework. And, this is important to people that I work with because they're being criminalized by it. Their community is being criminalized by it. And so I think I also wanted to take a moment specifically, Kat, to address this question that is in the chat as well, if that's okay. It talks about, shouldn't there be penalties for people living with HIV who knowingly spread the virus to sex partners? No, I don't think so. I think, are we asking that question about herpes? Are we asking that question about chlamydia? Why is HIV singled out and treated differently? I think this goes back to sexual health and responsibility being on both partners, not just on one person. Both individuals need to take responsibility for that, not just if a person is living with HIV, not just if they have herpes or any other STI. Not only that, I think the COVID-19 pandemic has really illuminated a lot of things for us. And we saw in the response to COVID, when they were trying to arrest people for not masking and not complying, it did not work. They had to shift to a public health approach. And so if they could figure it out that quickly with COVID-19, we need to be able to figure it out with HIV as well. The focus should not be on criminalization. It should be on connecting people to care, on treatment as prevention, on post-exposure prophylaxis, on all of those things and the public health approach instead of focusing on criminalization. So I always understand this question, but I actually think that it is misplaced. And so, I completely understand the need and want to ask it. And I also think too, that when we're looking at criminalization right now, it doesn't require that you knowingly spread the virus. A lot of times it doesn't require transmission, and it doesn't require the intent to transmit. It doesn't even require the likelihood of transmission. So that's not how these laws are even functioning right now when they're on the books. So I just wanted to point that out. And because I think it ties in with why people want to decriminalize HIV. I think those two issues go hand in hand. So we want to decriminalize it. We want to take away the stigma with HIV. We want to make sure that everything is rooted in science. We have this data, we have this knowledge. Now we need to catch up the laws with it. So I hope that ties everything in.
No, that does. All of those responses were wonderful and really great. And I'm trying to think of, there was many things that were said and specifically of like, I was trying to think of like catching up, like where it's like the law needs to get behind, like there's like science, there's data, all of it that supports all of these things. And it feels maybe like a naive question to ask, where it's just like, what is the point of criminalizing HIV criminalization? I mean, of HIV. There's, again, it's naive in terms of like, I can think of like the root issues of like racism, slavery. You just, you're wanting to not deal with it and then just lock people up thinking that the issue will go away when it won't. So yeah, so thank you for all of those responses. And before we go into the next question, I just kind of have a question there of like resources for folks. Like, do y'all have, I know like your websites, but if there's like all of these coalition spaces of like what are some ways that folks can be engaging in those conversations and like continuing to be in these spaces and making sure that folks directly impacted doing this work are in their spaces as well. So if you just have a few resources, I feel like, because I'm like, I don't want to lose it. And as we're like in the chat, so if either of you, all three of you have anything that you want to share or say, and then we can go into the next two questions.
I will shamelessly plug my organization, no problem, by saying that we have a PJP newsletter. You are welcome to sign up for it via our website. It is going to be coming out more frequently now, and it gives updates as far as what is happening in terms of legislation across the nation, as well as information for how to join those various coalitions. Reach out to people. There's a ton of organizations that are doing this work. So I would encourage individuals to not be scared, also to just directly reach out. and ask them how you get involved. But more specifically, if you sign up for that newsletter, it will give you those updates that you want and that you're looking for, as well as the contact information for any coalition that you may want to join. I think the other thing is attending any sort of conferences that you see that could be helpful. And for instance, HINAC is next week. It's a training academy for HIV advocates. I think there's probably still time to attend virtually.
Yeah, so I want to plug, of course, send money to CHLP and Mississippi Center for Justice, specifically to the Mississippi AIDS Justice Project. Linda and her team do an amazing job every year bringing impacted folks, advocates, folks who are working at the legislature, folks from the health department, to really do a lot of what we've been talking about, which is to share the message, to demystify, HIV, to talk about science, and to really help to reduce stigma. And so please support the work that these organizations are doing every day, tireless work to really reform these issues. I also say the Williams Institute, has been really great about the research around HIV criminalization, what reform looks like, states that are impacted, and just a lot of the data that we have about who's impacted, has been from the Williams Institute. And so, for us folks who are working on the ground, it matters to have the data and the research to say, Black people are the folks who are being criminalized. And here is the data that tells you that, because sometimes people don't want to believe us without the data, even though we know and we're embedded in community and know. But that has been a really, really helpful in the work that folks are doing. And so I just want to lift them up, and y'all hit that Cash App for them. So
I appreciate that, Eric. And I just want to add, and Jada says she's giving the shameless plug. Don't be shameless, because we utilize your organization as not only a resource, but to help support the work we actually do here. So that's my go-to organization. So I'm grateful that you all are there doing such a wonderful job across the country to help reform. Having the great research and work you do at our fingertips is huge. I print it out, highlight it, share it. So thank you. And, and I would add that at the Mississippi Center for Justice, as I said, we have a decriminalization coalition. It is not the Mississippi Center for Justice Coalition. This coalition belongs to Mississippi. So anyone who wants to be involved and engaged, we would love to have you join this effort. We need everyone on board, as many people as we can get. So this does not belong to us, it belongs to the people.
yeah, and I just have one more shout out, and that's Mandisa. I see you're on here. And so, I just want to also say just the leadership at CHLP, supporting the leadership of Black women who are doing and leading this work, who have an analysis and a framework that is inclusive, that, prioritizes race, I think is going to be key to how we are able to advance this forward. And so, I just want to shout Mandisa out, who's been, a soldier in the work, and who is now leading the helm at CHLP. And, I think leading the work in a new and sort of, not even sort of, in a new refreshing way. And so I just want to applaud you and, take my hat off to you as well. So So thank you so much.
Thank y'all for
Amen
that.
to
I know,
that.
yes, we love Mandisa. And thank you for that. And I know sometimes that's like something towards the closing, but I just wanted to capture in that moment everything that y'all were saying, because it's so powerful and so important. So back into the other questions as we're almost finished with the discussion to then go into some Q&A for folks. So just a reminder for folks who are here, feel free to keep dropping your questions in the chat, drop them in the Q&A, and we'll have time in a little bit to be able to answer them. So we love to dream. I'm a big dreamer. I daydream all the time, probably more than I should. But I want to know from each of you is what is the vision and the hope that you have for this movement, for the movement of HIV decriminalization? Big question. No limit. Dream big. And I will let whoever wants to start go for it.
Linda, looks like you got all the wisdom. I
I
see all
don't know
the
if I have
wisdom.
all the wisdom. And my answer is, thank you, Eric. My answer is actually pretty short. I want to see HIV criminalization nationally ended, gone, period. That no one in this country has to worry about being criminalized for a medical condition. It's awful. And even thinking about the enhanced penalties, if someone with HIV does the same thing that someone does not have HIV, that is just in itself the desperate treatment of individuals, of people, these are people's lives. I embrace the national movement so much because it's shining a spotlight on what's happening in states where the movement is slow. Someone made reference to the correlation with COVID a little while ago. I think about even how the states that have expanded Medicaid, if you overlap again, looking at the social determinants of health, it looks the same. Whatever the issue is, Mississippi has an expanded Medicaid. So I just think about the impact that this has on individuals, on their families, on providers, on people who love and care for people who have HIV or are affected by or that's negatively impacted. It's just, it's devastating for individuals and families, and it doesn't need to be here. So my vision is to see it gone. Of course, in Mississippi, we want it gone. We want complete reform, but to not have anyone have to go through this at all, anywhere, no matter where you live, no matter who you love.
I feel like we're all going to have the same answer, right? Because if we're talking pie in the sky, like the ultimate dream, there would be no criminalization. It would all be a public health approach. We would have expanded free testing. We would be working on medical mistrust. We would be getting more Black doctors. But if I'm thinking more realistically, if I can't have that happen, what I would love to have is have Rep. Barbara Lee's bill pass where there is some sort of federal guidance on how to engage with HIV decriminalization, having some sort of guidance and guidelines on how we should approach these cases. I think even speaking more broadly outside of just that, having a more widespread understanding and knowledge regarding HIV. I mean, there are literally people that still think you can get it from spitting or playing with sex toys. It blows my mind that people still think that exists. You know, I often think about an episode on Girlfriends where one of the friends had HIV and she cut her hand, and Joan was like, I'll just throw this knife away. And she's like, no, you don't have to do that. And she still threw it away. I think about that all the time and think how many people actually think like that. And don't know how HIV is transmitted and treat individuals that are living with HIV like that. And so I think, speaking just from a public health stance, I would love to see the destigmatization of HIV in general and more understanding about how it works. People don't know that you can take one pill a day. They don't understand treatment as prevention. They don't understand U=U and that you can't transmit if you're virally suppressed. I just think there's a lot of misinformation out there. And so I think that that is going to be a large part of it. You know, it's so different from state to state. And you can see sometimes in the legislative committees when they have hearings, I see someone here talking about the homophobia that comes out, and just like the refusal to recognize data and science. You can see it firsthand if you ever watch any of the hearings surrounding HIV decriminalization bills. People cannot wrap their heads around HIV decriminalization. And if you throw sex work in the mix, they about have an embolism. I mean, in Oklahoma, even the caption of their bill is like intentional transmission of HIV for their prostitution statute. It doesn't require intentional transmission. You can just agree, you can solicit, so you can agree to perform a sex act, never even have sex, and still face a charge there. And it was like they were speaking French in the committee when they were talking about this issue, and the caption of the bill really confused them. And these are people that are making our laws. If they're that easily confused, imagine the general public. And so I would love to see more education surrounding this area, more federal money and government money to engage and do those things, and more access for our communities.
Yep, I'm agree with all of that. And I'll add just you know, and I know this is some of the work that is coming up hopefully soon with CHLP is around, you know, expunging records. So folks who have been criminalized in the past, you know, making sure that we, as we are reforming these laws, we need to also make people whole who have been you know, served time and who, you know, have this on their record. And so that will be like an additional wish of mine. And then the other piece is freeing Nashawn Williams, you know, has been, you know, it's been what, 20 years now?
Or just getting rid of civil commitment in general.
Or getting rid of civil commitment. Yeah, either or. And so those would be just my additions to all the things that y'all have said.
Linda, were you about to say something? It looked like you were about to.
I was just gonna say, I love that. You know, the expungement piece, that helps to eliminate even further systemic, you know, devaluing people in the community when you can't even work. So you've you know, done your time, but you're still being punished. You know, so we have to think about the long-term ramifications of what this will do to individuals and to families.
And then for throwing out dreams, I have one more.
Tell us, Jada.
It just jumped in my head while we were talking.
I said no limits, dream big, keep dreaming.
Outside of like TV and movies and how they portray people living with HIV, if we could get the media to just stop demonizing people that live with HIV and the way that they talk about people that live with HIV, they misgender, they use the wrong pronouns, they're homophobic in their news articles and report. In fact, a couple of years ago, they even gave identifying information so they could find the individual's house and printed it online in a news article, which is crazy to me. And so I think another thing that I would really like to see is just stop demonizing people living with HIV, stop making it a salacious tabloid fodder to get more clicks. I think that that feeds into the stigma. And I would really love to see some education around that and just them approaching the articles in a much different way. I think it has a huge impact on how the general public views HIV criminalization, and they only see those stories. That's the only time they ever hear about HIV. So that's informing their opinion of the HIV community as a whole. And I think it's very dangerous.
No, that's so real, Jada. And I mean, all of the dreams and visions that you all have are so beautiful. And so I want them all to happen as well. And it's making me, think especially a lot about the misinformation and where it starts, like even just in our schools, when you're talking like sex education in 7th grade or 3rd grade, whenever you start it. And I know that that is also something that is being so targeted right now. And again, coming back to like that the intersectionality of how it all relates and like the body autonomy that you were talking about, Eric, of just like where all this misinformation starts and where it spreads and how can we stop it? How can we set up barriers? How can we dismantle it? How can we blow it up and destroy it and make sure it never comes back again? So thank you for all of those beautiful visions and dreams. And it was a perfect segue as we were starting to talk about expungements. I got to bring it back to the L4BL of who our network and community is of lawyers and legal workers and legal advocates and law students. And so from the work that you do, from the people that you're in community with, what can lawyers and legal advocates be doing to support HIV decriminalization campaigns and coalitions, and what additional skills are needed? And I know you all mentioned expungements, which is huge. And we've recently just put out a call to our network to help with expungements for folks in California who were facing drug charges and are trying to get into this reentry program. So if there are other skills or other things that you can think of that folks in the legal community or environment could be doing to support this and amplify this movement.
Yeah, I think a couple that come to mind. One, CLEs. So I know that in Georgia, we've done a few CLEs that I think have been successful. The other thing is like being a part of coalition work. I think it's really important for lawyers to be a part of that work. I think, some of the sausage making of like writing legislation or reading legislation, knowing where to put a comma or an and or an or, makes a difference, and lay folks just don't know. And so I think we have an important skill that we can offer to coalition work in that way. Not in other ways of, sort of like, this is the way that it has to be, but no, just like, here are some skills that I have. This is what I can offer to this. And then I think the other piece is around just sort of like pro bono work. I think that what we see often is that someone will get charged, somebody will reach out to me, Linda, or Jada, and they're like, folks need, some legal representation. And it can be difficult finding legal representation for folks that is, one, free or low cost, and with folks who are like gonna be the right type of lawyer to deal with this type of case. And so I think that those are some of the ways that we can that lawyers can be involved.
Yeah, I think lawyers, showing up for this issue. I'm gonna be tooting Mandisa's horn again. Like before she became our ED, she was an advocate in the Louisiana Coalition, right? So being invested in this work, being able to break down legalese and legislative language is confusing. Lawyers argue over that language. So being able to break it down for a general audience and explain to them what it is doing and how it can be proved, I think is just so vital to our work and these efforts. CHLP is going to be revamping our HIV collaborative, which is going to be basically, we want to have at least an attorney in every state that we could contact, because we get a lot of outreach from cases. And I think actually at some point collaborating with Eric on a list that's specific to Black attorneys, because Black people are facing the most prosecutions. So looking at those opportunities where they can actually engage, and I think accepting help when it is needed. These cases are difficult. I think oftentimes, CHLP, we will do direct outreach when we hear of a case. We will track down the attorney and do direct outreach, and we don't always get a response. And in my head, I'm thinking, there is just no way this attorney knows the ins and outs of HIV criminalization to the degree that they should to be representing this person. If I were this an attorney and an organization had reached out and they were subject matter experts and were offering to lend a hand, I would be chomping at the bit to take them up on that. And so I think being willing to accept help from those subject matter experts is just crucial as well. CLEs, I think expanding, I agree with Eric, expanding CLEs and just making sure people, there are public defenders that I'm sure are shocked when these cases come across their desk. It's not something that you're even necessarily, you don't know about it if you're not involved in this work. And so I think broadening the audience and even requiring judges to do CJEs, continuing judicial education on these topics, would also be helpful. If judges are into it, lawyers will be into it.
And I'll just add, specialized training, I think, is huge. Join coalition efforts so that you can see the natural formation of how this works and the progression of the coalition, and being able to meet people who have been impacted, or organizations who serve impacted communities. And it's already been said, CLEs allow folks like us to speak at your conferences, to tell, let you know what's going on. Let's do this webinar should be a good conference. We can do things like that. And use, and Jada's already, so some of these things have already been said, but using us as a resource. I mean, that's like low-hanging fruit to be able to say, to get some help with the interpretation, the differences, the distinctions, the enhanced penalties. And if capacity permits, organizations and individuals, one-on-ones, I think, are wonderful to be able to have conversations with prosecutors in particular, and law enforcement, but to have those, one-on-one conversations, and even staff trainings. If there's not a CLE, let us come talk to your staff. Let us, let's talk about what other statute you can use if there has really been some issues, but this is just not acceptable. So I think those are a lot of, Jada and Eric has already given a lot of good thoughts as well around that. So.
Amazing. Thank you for all of that. And I appreciate, Linda, especially when you were saying, reach out to us. And it's what I think you were saying, the comment earlier, or maybe it was Eric, one of you brilliant ones was all saying of like, we need to be talking to each other. And that's like such a big part of how we're going to move this work, how people are going to get free from HIV criminalization, is talking to each other and understanding what's happening. Because again, like Linda, as you said, this is an everybody issue. This is not a one group of people issue. This affects all of us. Okay, I'm going to see if there's any questions, Q&A. I'm looking in the box, I'm looking in the chat to see if there were any that maybe we missed in the beginning. Ew. And if we don't have any questions, then we can go to the closeout and people can get some time back to their Wednesday evening. Because I know it's been a long day. So I am not, Kim, am I missing anything? I'm not seeing anything in the box or in the chat.
No, it was just that one question that already got answered.
Perfect. Well then, Jada, Linda, and Eric, I can't thank you enough for this incredible conversation. And there were so many takeaways from it, so many things I'm going to be bringing back to our staff. I was like, yo, Kim, we got to get a staff training on this ASAP, and reaching out to our networks and getting folks to start talking to each other, to engage, and to go to all these websites and these incredible resources that y'all dropped. Because yeah, this work is not done alone and we all need to be doing it together and supporting the work that you are all doing. And so I just, a deep, deep thank you and lots of gratitude on this side of the computer screen for you all. And I hope this is not going to be the last time we're in conversation, and we're going to try and put on a conference about that. You know, I'm here for it. So thank you again so much. And thank you everyone who was able to join us tonight on a Wednesday night in these summer evenings that are starting to come about. I know it's a lot to ask, so I will happily give you back 9 minutes of your time. And thank you all again so much. And I hope you have a beautiful rest of your evening. Bye, y'all.